Broadcasting from Manhattan Beach and the World Wide Web, you're listening to CHSR, HealthyLife.net.
As a service to our listeners, this program is for general information and entertainment purposes only. CHSR HealthyLife.net does not recommend, endorse, or object to the views, products, or topics expressed or discussed by show hosts or their guests. We suggest you always consult with your own personal, medical, financial, or legal advisor.
Welcome to Center Point. I'm your host, Dr. Ron Anbar. In this show, we will discuss ways that we can journey to our own centers. This can help us access our inner resources to improve our physical abilities and health, our mental strength, our emotional well-being, and our spirituality. And today we have a very special guest, my good friend, Dr. Rebecca Cherry, who has been involved in hypnosis for many years. Welcome, Rebecca.
Thanks, Ron. I'm so glad to be with you.
So just a brief background on Dr. Cherry. She trained as a pediatric gastroenterologist and incorporated hypnosis into her practice over 10 years ago while she was on the faculty at University of California in San Diego. Over the years, she's taken an increasingly integrative approach to digestive disorders and now has a small independent practice. She continues to treat children with GI-related problems and also has broadened her focus to take care of patients in a wider age range for functional and stress-related symptoms. And functional symptoms are those for which there's no physical cause or no known physical cause. So Dr. Cherry went to medical school at Harvard and did her postgraduate training at Vanderbilt University Medical Center in Nashville and the Children's Hospital of Los Angeles. Her hypnosis training has been mostly through the National Pediatric Hypnosis Training Institute and the American Society of Clinical Hypnosis. And she now lives in Philadelphia. And we just had a chance to visit with each other last week when I was in the East Coast. It's nice to see you then, Rebecca. So I'm very curious. Tell me, what got you interested in hypnosis more than a decade ago?
Yeah, it wasn't something that I ever expected before that I would be doing. It's not a technique that I had learned about during my formal training at all. But a few years after I finished my formal training, when I was working at UC San Diego, I was the interim director for our program in GI neurogastroenterology and motility. Because many people may not know it, but the GI tract has its own nervous system, which is called the enteric nervous system, and there's a subspecialty of neurogastroenterology. And many of the patients who we saw in neuro-GI and motility were patients with chronic abdominal pain who typically fit the diagnostic criteria for things like irritable bowel syndrome, but who weren't getting better with the kinds of treatments that we had available to them. And so we would do test after test and medication trial after medication trial. And it was frustrating for us as medical providers, and even more so for the patients and their families. And it was at that time that I came across the academic literature on hypnosis for treatment of chronic abdominal pain in children. And when I read it, my first thought was, this is too good to be true. This can't be real, right? If this were real, we would all be doing this. But the more I looked into the literature, the more I realized how much evidence there was to support it. And so very quickly, within a month, I signed up for my first hypnosis workshop, which was in Alexandria, Virginia.
So I wonder if we could drill down some more on the neuro-GI relationship. So you said the GI tract has its own nervous system.
Yes.
Right. And how does it connect to the brain's nervous system? How are they related to each other?
They're related primarily through a couple of major nerve, primarily through a nerve called the vagus nerve, which is one of the nerves that runs from the brain all the way down through the chest into the abdomen, and has branches pretty much each one of the abdominal organs. And so the vagus nerve is I would say, the main conduit of communication between those two parts of the nervous system.
But if it has its own nervous system, does it act independently of the central nervous system as well?
To a great extent, it does. There's a lot that the enteric nervous system does that the brain just doesn't get informed of, or only gets informed very indirectly. For instance, the digestive system has its own taste receptors, which the brain is not privy to. We don't taste with our intestines in any way that we're aware of, but the nerves in the GI tract will respond to the flavors that they're identifying. If something tastes especially bitter, let's say, and tastes like it might be poisonous, then just through local feedback and interactions, it will cause people to vomit or have diarrhea to get rid of this toxic substance. And so what the brain knows is that, I feel really nauseated, or, I feel like I'm going to have diarrhea, but doesn't have any insight into what that initial trigger was, what that taste was.
That is fascinating. So have people done electroencephalogram studies on the enteric nervous system? Are there waves of electricity, like stomach waves, that exist?
Well, there are tests of the stomach, electrogastrograms, which are done really only in a few centers and more on a research basis. As far as I know, there aren't any EEG-type studies of the intestine itself. What we do more to measure things a little bit less directly is we can measure the strength and the frequency of contractions within the GI tract. But again, that's just an indirect measure of what those nerves are doing.
And do you think that the enteric nervous system, again, enteric means the gastrointestinal system, the enteric nervous system is like a primitive brain, like it's by instinct, or do you think it thinks in some way, or do we know?
My impression is that it doesn't think in a complex way. It is much less smart than our brain. It has a very limited repertoire of reactions. And that's part of the problem, that it can't provide complex interpretation of the stimuli that it encounters. It only has these blunter sorts of tools, like making you throw up or giving you diarrhea or signaling pain, for instance, rather than communicating in more granular detail to the brain what exactly it's reacting to.
Because when we do hypnosis, sometimes we talk to the gut, right? We give messages, which
yes.
I guess I always thought our brain registers and then lets the gut know. But is it possible we could talk directly to the gut, do you think?
Well, I think we speak to the gut through the intermediary of the brain, and exactly how those messages get transmitted, I really don't know. But I do know that it works. So it was similar to the way that we don't really understand how many of the medications that we use work. We can describe what the molecules might look like, but we don't exactly know how it is that they're achieving their function. Same thing for hypnosis. We know that it's working, but to tease out exactly at which level of the nervous system it has each of its effects, that's less clear.
That's interesting. I wonder if you could do a study in which the brain is asleep and you talk to the gut and see a reaction of the gut. That would be an interesting study. We know things happen under anesthesia. Like when you're under anesthesia, sometimes we are aware of things that we don't remember later.
Right.
So Fascinating. So you learned about hypnosis. Did anything surprise you when you learned? Did you find a lot of new material that you didn't realize was there?
Well, there were several. I mean, it's hard to do studies. I'll just be frank. It's really hard to do studies on hypnosis that meet the criteria that we usually think of as high quality studies, because it's really hard to do a double-blinded study of hypnosis where the person whose intervention doesn't know what the intervention is. And that's standard for a lot of drug trials, is a double-blinded, randomized, placebo-controlled trial. So it's hard to do that with hypnosis. And for that reason, the studies are relatively few and relatively small compared to most of the medications that we use for a condition like irritable bowel syndrome. But even though the studies were small, I'm sorry?
So to clarify, the double-blinded study, the patient doesn't know whether they're receiving the therapy or not, and the physician doesn't know whether the patient is receiving the therapy or not. So it's hard, for example, to do hypnosis with the patient and not realize you're doing it, and it's hard for the patient to know that, well, I'm not getting hypnosis. I mean, it had to be a very tricky kind of study design for the patient to think they're getting hypnosis, but they're not, which is what you're talking about.
Although I will say that as physicians, we don't always know. We don't always recognize that we're doing hypnosis, which I believe we'll probably touch on a little bit later.
Correct.
But even though the studies that were available were relatively small in terms of their subject numbers, the study designs were excellent, and the outcomes were quite amazing. The extent of improvement, the frequency of improvement, was something like 80%, 80 to 85% for their study subjects over the course of the year after they started the study, and even at a 5-year follow-up, they were still doing well. So this was a treatment, apparently, with amazing durability, amazing staying power, unlike medications, which typically work. If they're going to work, they work for as long as you use them, and then when you stop using them, you lose the benefit.
So what kind of patients have you worked with who benefited from hypnosis?
I've worked with really a range of patients, primarily with kids, although in the last few years I've been working more and more with adults, many of whom have had those, I would say, more easily definable conditions like irritable bowel syndrome, but many of whom have had less well-defined kinds of symptoms or other sorts of GI upset, or GI upset as part of some kind of a larger condition. For instance, I've seen many patients who have something called emetophobia, which is a phobia of vomiting. And oftentimes, patients with emetophobia get referred to gastroenterology with the complaint of nausea, this chronic nausea, when in fact, it's not exactly nausea that they have. It's more a fear of becoming nauseated. So it's a little bit tricky sometimes to pinpoint the diagnosis, but when one does and can identify that it's a phobia rather than a nausea itself, then treatment with hypnosis is relatively straightforward.
So tell us how you treat a patient with emetophobia. I've found that those patients tend to be tougher, in my experience, than with some other GI problems, such as irritable bowel syndrome. In my hands, has been very responsive. But how do you approach a patient with emetophobia?
Well, when I'm treating emetophobia, I will often not use so many direct suggestions for a decrease in the sensation of nausea, even if they have nausea. but I will more emphasize their ability to cope with it. I also, compared to patients with some other phobias, it's entirely possible that a person is going to throw up again. I mean, it could happen any time. So I can't give any false guarantees that, oh, don't worry about it, it's never going to happen, because it might. But I do try to bring them to a clear understanding of how likely or unlikely it is, and how they are capable of dealing with it if it happens. Because most people who have emetophobia have had the experience of vomiting, and they've survived it, and they've been okay. And so reminding them, reassuring them, helping them to reassure themselves that they can cope with this phenomenon if it happens, that can be a real mainstay, along with an explanation of things like the way the enteric nervous system works, explaining that if one does throw up, there's usually a good reason for it. They might actually feel a lot better after they throw up because it's fixing a problem.
So in the patients you've worked with emetophobia, do most of them overcome it? They say, I'm not afraid anymore, or they say, I can deal with this now, I'm okay. How do they respond?
Most of them do feel better. Whether it's 100% improvement, I think is sometimes hard to say, because, to have some concern about it, I think is in the range of normal. But they're able to function better. They're able to go back to school, or they're able to eat a meal out in public without that same kind of fear that they're about to throw up.
It's marvelous. It's amazing the power in the mind, sometimes to make us feel bad, but even more importantly, to help us feel better and embrace our challenges, which I think is what you're teaching your patients to do.
Yes, yes. And to remind people that they're tougher than they realize.
Right. Finding the power within yourself, because after all hypnosis is self-hypnosis. So teaching people to find the power within themselves to help themselves is such a key teaching point that we tell our patients about.
Yes.
So, is there a patient that stands out in your mind that, you say, wow, how did that happen, like a very memorable case that you might share with us?
Oh, goodness. There's a number of them, but I'll tell you about one of the earlier ones, one of the patients who provided that encouragement after my very first workshop to keep on going with the effort to train and to use the hypnosis. And this was a boy, I must have been about 11, a little boy who was in the hospital. I think he was on the rehab service, but I got called in for a GI consultation because of a refusal to eat. And this boy had a choking episode, and after the choking episode had become so fearful of choking that he developed a phobia of eating, and had lost a tremendous amount of weight and was being named nutrition. And so I was asked to come and see him, and I had just, in the last week or two, I think, done that first workshop of training. And so I proposed to him and to his mom that I use hypnosis to help him overcome his fear. And they were quite receptive. One of the wrinkles was that although the patient was an English speaker, his mom was not. She spoke Spanish only, and so I had a simultaneous translation going on for the mom so that she could understand what it was that I was saying to her child. Because I certainly didn't want her to feel that I was, or to worry that I was saying anything inappropriate. But he did great. We did one session. He, in hypnosis, imagined himself, and I had really no idea what he was going to do, to be perfectly honest. He took himself to a noodle restaurant in Japan where he easily and comfortably ate noodles and felt them sliding easily into his stomach. And in hypnosis, he practiced that sensation, that motion of swallowing. And after he re-alerted, he was better. He was eating again.
Amazing. So when you came to see him, did people already know he was afraid of choking, or did you figure that out when you talked to him?
That they were already aware of that, and he'd been seen by some therapists who were, I think, using some more cognitive, just were progressing a little too slowly to get him off of the IV nutrition and out of a hospital.
I think it's so important that we listen to the children. I remember there's one boy I worked with who kept locking himself in the bathroom, and the parents kept yelling at him for doing so. And when he came to see me, I said, "Why do you do that?" He said, "I'm afraid of monsters." I said, oh, then let me teach you about monster sprays. And that took care of it. He would spray the bathroom, and then he didn't have to lock it anymore. And so oftentimes we don't ask the child what's going on, and if we do, you find the answer. So thank you so much, Rebecca, for sharing so much. When we come back, I want to ask you a little bit about what you wish the public knew about hypnosis and how we can reach out better as a field. This is Centerpoint with Dr. Ron Anbar.
Healing and changing children's lives with hypnosis is very real and very possible. Dr. Ron Ambar's new book, Changing Children's Lives with Hypnosis, provides you meaningful stories and expert explanations to show you not only the process of hypnosis, but its many benefits for overall wellness. Whether a parent, practitioner, or medical doctor, this book opens the way to complete connection, so necessary for healing. Get your copy of Changing Children's Lives with Hypnosis at Amazon.com or visit dranbar.com.
HealthyLife.net, where positive overcomes negative.
Dr. Ron Ambar and his dedicated team of healthcare providers offer unique health services to help patients overcome psychological roadblocks or use the power of their minds to improve their overall health and well-being. At Centerpoint Medicine with services in La Jolla, California and Syracuse, New York, this caring staff are waiting just to help you. Find out more at centerpointmedicine.com. Can't wait? Make your appointment now. Call 858-201-4001. That's 858-201-4001.
Audiobooks gives you instant access to over 50,000 of the best sellers and hottest book titles in romance, mystery, fiction, and many other genres. Just visit HealthyLife.net's advertiser page and click on Audiobooks to get started.
Every year since opening Centerpoint Medicine, Dr. Ron Ambar has been overwhelmed with demand for his services. So much so that he has established a first-of-its-kind franchise opportunity. As a franchise owner of the leading pediatric hypnosis counseling center in the U.S., you'll be at the forefront of an exciting sector of healthcare as you increase your revenue. With low overhead and full support, it's your time to take advantage of this franchise opportunity. Just call 858-997-3196. That's 858-997-3196.
HealthyLife.net, where positive overcomes negative.
If you are a medical or licensed healthcare professional or just anyone looking for a qualified hypnosis practitioner, then go on over to ASCH.net. That's the American Society of Clinical Hypnosis. At ASCH.net, you can get certified, attend workshops, and even find a hypnosis practitioner or consultant. ASCH provides an opportunity to learn and interact with colleagues. So whether you're a professional wanting to learn hypnosis or a patient wanting help with a problem, visit ASCH.net now.
More exhilarating talk. HealthyLife.net.
Welcome Welcome back to Centerpoint with Dr. Ron Anbar, and I have my special guest, Dr. Rebecca Cherry, who has told us a lot about the nervous system of the gastrointestinal tract and how it interacts with the central nervous system and how we can help so many patients feel better, sometimes in a very short period of time. So I'm wondering, Rebecca, what do you wish the public knew about hypnosis? What's the main message you want them to hear?
I would like people to have a better understanding that it's not magical, although it might feel magical sometimes. It's something that people do all the time, even without knowing that they're doing it. People go into the state of hypnosis quite often, but they don't put it in those terms to themselves. They think of it as being in the zone or being in a state of flow. But nearly everybody who I talk with about it can relate to that experience. They just don't realize that they've got this powerful tool available to them.
Right, and getting people to understand that is, of course, the mission of this show and of other outreach. I'm wondering, how do you think we can do a better job at getting the word out? That's an ongoing mission question.
I wonder whether it would be most helpful to do it by addressing the health providers and encouraging them to recognize that they're using it too, and to deliberately use it, because just the way that regular individuals are using hypnosis, so are health professionals. Every time a physician says to a patient, let's try this medication, or tells them, I don't think you have a problem that you need to worry about, or gives them any indication of prognosis, those can all be hypnotic statements. And when we make them more deliberate, when we are more mindful of not only of our tone, but also of the actual words we use, it can really make a difference.
I think, well, I know you're right. I know that we've been talking to the healthcare field for 70 years about how hypnosis can be helpful. And I also know that the healthcare field does not register it, perhaps because it doesn't see the value, or it views it too hard to learn, or it means you have to do something different than before. There's all sorts of hurdles. I'm wondering, as we're talking, whether if we could tell the physicians, hey, you can help yourself with this technique, you might want to know about it. And I wonder, have you used hypnosis yourself? And what have you used it for?
Yes, I used hypnosis myself. And, you know, and now that you mention it, I've also used hypnosis for the children of a number of physicians who've heard about hypnosis from me as their colleague and who've been really pleased with the outcomes. I've used hypnosis myself for a few different things. I've used it to help myself with procrastination, which is an ongoing part of my life curriculum, one might say, and also in terms of just everyday behaviors. I've used it to be more careful about eating only when I'm hungry and stopping when I'm satisfied.
So explain, like, how did you use hypnosis for procrastination? What kind of suggestions did you do? Or what kind of imagery did you do? How does it work?
You know, I don't exactly remember because it was quite some time ago. What's fresher in my mind is the hypnosis for eating only when I'm hungry and stopping when I'm satisfied. And that I really took some inspiration from a patient who I was helping with constipation. Using a different kind of physical sensation to remind myself that I do have agency, that I have control. So just as I might be able to tell, for instance, that I need to blow my nose, right? I wouldn't blow my nose if I don't feel like I need to blow my nose, and I'm going to stop blowing my nose when I'm done. So really any physical impulse or physical sensation can be used in that same way.
So how do you use it for eating? How do you continually ask yourself, am I hungry, or how do you tell yourself to stop?
Yes, I it's not even so conscious. It's not so deliberate. It's just become an ingrained part of my behavior. I do sometimes have to remind myself to slow down and to put my fork down between bites. That's the behavior that I need to remind myself of. But in terms of the recognition that I'm done, that has just happened, one might say, on its own.
And when you use hypnosis with, like, putting the fork down, did you imagine doing so? Is that what you did? Or did you tell yourself, I want to slow down? Or what kind of self-suggestions you give to make that work?
Yes, I did give myself the suggestion of putting the fork down or between bites, or putting the food down between bites, because sometimes it's something you've got in your hand. You're not eating it with a fork. But to put the food or the fork down in between bites, to finish chewing and swallowing what I've got in my mouth, and then to assess, am I ready for the next one?
That's so interesting. I think you mentioned before being in touch with your body sensations. So when I was working, still working, controlling my weight, when I become hungry, I have learned to tell myself, oh, this is a good feeling. I must be losing weight right now because my body wants more food. And so I'll say, oh, okay, hunger, that's good. I'm going to drink a little cup of tea without any sugar added and wait till the next meal. But I'm happy with the hunger. So
yes, so a real reframing of a sensation that you might previously have thought of as bad.
Exactly right. So I look for hunger. So if I'm not hungry before a meal, I tell myself, I must have overeaten earlier. Or I need to be more careful. I need to eat a smaller meal.
Oh, that's very reinforcing.
Yeah. So I think pay attention to oneself and learning how to become more mindful of oneself and the symptoms. We're talking about the gastrointestinal tract. Being mindful of the symptoms in the GI tract can really guide us. Yeah. I do have one
interesting. Oh, go ahead.
No, please.
I was going to say on that subject of mindfulness, oftentimes people will come to me without a recognition of what's causing their GI symptoms. And it's only after a few sessions that they start to realize that there's an association between being anxious or having something stressful happen in their life and their symptoms.
Yeah. Next week's guest on the show, by the way, is a patient with abdominal discomfort, and he's going to talk about how he interpreted and sometimes misinterpreted his abdominal discomfort to mean various things, be it physical or psychological. And it's actually, now we're thinking about two different nervous systems, it actually puts a whole other perspective on what might be going on. So, Rebecca, thank you so much for sharing all this wonderful knowledge and experiences with us. You've taught me a lot, and I hope you've taught our listeners a lot. And maybe you'll come back on the show another time, and we'll see what other adventures have occurred in the coming months. So
thank you so much. I would love to.
And thank you so much for joining us. So this is Centerpoint with Dr. Ron Anbar. We'll be right back after these messages.
Make-A-Wish has been granting life-changing wishes for children and families for over 40 years. A wish is something that gives children the opportunity to look outside their illness and restore a sense of childhood back to the child. With the help of donors and more than 43,000 worldwide volunteers, Make-A-Wish has collectively granted more than 520,000 wishes worldwide. Dr. Anbar has referred many patients to Make-A-Wish. To make a donation, go to worldwish.org. That's worldwish.org.
HealthyLife.net, the Positive Radio Network.
Healing and changing children's lives with hypnosis is very real and very possible. Dr. Ron Ambar's new book, Changing Children's Lives with Hypnosis, provides you meaningful stories and expert explanations to show you not only the process of hypnosis, but its many benefits for overall wellness. Whether a parent, practitioner, or medical doctor, this book opens the way to complete connection, so necessary for healing. Get your copy of Changing Children's Lives with Hypnosis at Amazon.com or visit dranbar.com.
Reach your health and fitness goals. Whether you want to lose weight, learn to dance, build muscle, or just live healthy, Beachbody gives you unlimited access to the nation's most popular fitness and weight loss solutions. Visit our advertiser page and click on Beachbody now.
Dr. Ron Ambar and his dedicated team of healthcare providers offer unique health services to help patients overcome psychological roadblocks or use the power of their minds to improve their overall health and well-being. At Centerpoint Medicine with services in La Jolla, California and Syracuse, New York, this caring staff are waiting just to help you. Find out more at centerpointmedicine.com. Can't wait? Make your appointment now. Call 858-201-4001. That's 858-201-4001.
HealthyLife.net, where positive overcomes negative.
Every year since opening Centerpoint Medicine, Dr. Ron Ambar has been overwhelmed with demand for his services. So much so that he has established a first-of-its-kind franchise opportunity. As a franchise owner of the leading pediatric hypnosis counseling center in the U.S., you'll be at the forefront of an exciting sector of healthcare as you increase your revenue. With low overhead and full support, it's your time to take advantage of this franchise opportunity. Just call 858-997-3196. That's 858-997-3196.
All positive talk with a mature edge. HealthyLife.net.
Welcome back to Center Point with Dr. Ron Ambar. That was a really good time talking with Dr. Rebecca Cherry and learning about the enteric nervous system and how our central nervous system interacts, our brain interacts with the stomach, and how we can use words to reframe how we think and feel better. So in this segment of the show, I'd like to share experiences I've had with patients. And since we're talking about words today, I wanted to talk to you a bit about how I helped patients reframe sensations in a way that's helpful to them as part of medical therapy. So when I was a practicing pulmonologist, I used to prescribe a medication called flonisolide. It was an inhaled steroid, and it tasted really bad. And generally patients would inhale it and say, yuck, I don't like it, I don't want to take it. And so I actually, even before I learned about hypnosis, I learned how to convince patients to take this medication. And this was done by the process called reframing, to think differently about the sensation. So when I would prescribe this medication, I would tell patients this medication comes in two flavors, yucky and mint yucky. Now, you might ask, why am I even telling them it's yucky? Because maybe they'll like it, because this is really foul-smelling. So if I said, hey, why don't you check it out, see what you think of it, they'll say it's yucky. Anyway, so it comes in two flavors, yucky and mint yucky. Which would you like? And they'll say, maybe mint. I'll say, good. And then I'll ask them, I said, do you know why this medication has a yucky flavor? And they say, no. And I said, it's to remind you to rinse out your mouth after using it. And I would say, do you know why that is? Why do you want to remember to rinse your mouth out? They said, no. It's because so you won't get athlete's foot of the mouth. Now, that's a very picturesque image. And the kids would say, ew, I don't want that. And actually, the problem with inhaled steroids is that it can cause fungal infections in the mouth if you don't rinse your mouth out. And so we always tell patients to rinse their mouth out after use. And what I explain to them is the yucky flavor is a reminder. So my patients would embrace the unpleasant tastes. My colleagues said they could never get their patients to take the flunisolide because as soon as they took it, they said, yuck, and I don't want to take it. Give me something else. And how would my colleagues prescribe the medicine? They would say, all right, here's a medicine. It's called flunisolide. Take it. If you don't like it, we'll give you something else. So what do you think happened? Everybody opted for another medication. But in my patient's case, they took the medication, they used it, rinsed their mouth out, and accepted the bad flavor, and because they had a reason for it. So that's called reframing. And how physicians prescribe medications can have a big impact on whether the patient takes it or not. Now, the same medication also served another way of, once I learned to do hypnosis, served for another example. So the patient would say, flavor tastes yucky, and I would say, well, why don't you change the taste? Change the taste? How can I do that? Okay, well, I'll teach you. What you do is you go into hypnosis, and hypnosis meant going to a relaxing place of your choice, imagining all your senses. And while you're in hypnosis, imagine what's your favorite thing to drink. Maybe they'd say chocolate milk. So I'd give them a glass of water, and I'd say, please taste this glass of water. What does it taste like? It tastes like water. All right, now, please imagine that in the glass of water there is chocolate milk. Imagine what it looks like. Imagine what it smells like. And actually go ahead and smell it and see if it smells like chocolate milk. Yes? Good. Now taste it. And notice how it tastes just like chocolate milk. That's the instruction. And many kids would say, oh, that tastes just like chocolate milk. Wow. And then they drink it all because they like chocolate milk. And I said, just like you can change the taste of the water in the glass, you can change the taste of the inhaled medication. If you don't like the mint yucky, change it into chocolate or strawberry, whatever you like. And if you want to imagine it being strawberry, imagine it being red, imagine it smells like strawberries, now inhale. And the kids would say, wow, it tastes like strawberry. Exactly right. And the kids would do that, would take the inhaled medication, say it tastes pretty good, and after a few weeks they'd stop doing the hypnosis. They would get used to the taste. So again, notice how we're changing sensations by suggestions and by thinking about things differently. And finally, we're talking all about use of words here. There was one funny incident that happened once early in my medical career. When you're a pulmonologist, you have patients do breathing tests called pulmonary function tests. And the way these tests work is you put a tube in your mouth and you blow into the machine as fast and as hard as you can for as long as you can. And the respiratory therapist will stand next to the child and say, blow, 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 keep going, keep going, keep going. And, you walk by the pulmonary function lab and you hear the respiratory therapist yelling, blow, blow, blow. So one day I was watching a young man blowing into the machine. I said, I want you to blow so hard, blow your guts out. And then the respiratory therapist says, blow, 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 blow. And the kid is blowing as hard as he can, blow, 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 blow. And then he throws up. Yeah, blew his guts out. The respiratory therapist made me clean up because I had given him a suggestion. I didn't mean to tell him to throw up, but in my inadvertent way, when I said blow really hard, I made that suggestion. That's how powerful words are. And physicians, as Dr. Cherry discussed, they don't realize that the words they use affect the patients so much. When you prescribe a new medication as a physician and you say, let's see if this will work, I'm not sure, but we'll give it a try, you've just negated a lot of the power of that medication. That medication, in fact, you just did what's called a nocebo effect. We've all heard of placebo. Placebo means the person wants to please the doctor, is how it's thought of. So you are given a medication and you think it's going to work, so it works, even if there's nothing in it. That's traditionally the placebo effect. You're giving a sugar pill, but it gets an effect. But placebo effects also work with real medicine. So if the medicine really works for your condition, if you think it's going to work even better. There's the opposite. the nocebo effect. If you think it's not going to work, it's not going to work as well. So when a physician tells the patient, hey, let's try it, maybe, we'll see how it works, and it doesn't seem very enthusiastic about it, it's going to have an effect on how well the patient thinks it's going to work. And if the physician says, hey, this medication has helped many of my patients, I'm really optimistic about it for you, then the patient is much more likely to say, hey, this really helped me. And it really did help. They're not just saying. It really does help. So the words, as we've demonstrated in many different times today, the words used to tell patients about what's going to happen affects what's going to happen. And in our last segment today, we're going to talk a lot more about use of positive words, how you can talk to yourself, because what you say is going to happen also affects what's going to happen. Henry Ford, the automobile manufacturer, knew this 100 years ago. He said, whether you think you can or think you can't, you are right. Whether you think you can or think you can't, you are right. And that's because what you say is what you manifest. This is Centerpoint with Dr. Ron Anbar.
More than 30,000 children and adults of every race and ethnic group in the U.S. have cystic fibrosis. Cystic fibrosis is a disease causing long-lasting lung infections, limiting the ability to breathe over time. Dr. Anbar participated in research that helped advance survival of cystic fibrosis patients by more than 20 years. He encourages you to donate to the Cystic Fibrosis Foundation to help find a cure. It's easy to donate. Go to cff.org. That's cff.org.
HealthyLife.net, the positive radio network.
If you are a medical or licensed healthcare professional or just anyone looking for a qualified hypnosis practitioner, then go on over to ASCH.net. That's the American Society of Clinical Hypnosis. At ASCH.net, you can get certified, attend workshops, and even find a hypnosis practitioner or consultant. ASCH provides an opportunity to learn and interact with colleagues. So whether you're a professional wanting to learn hypnosis or a patient wanting help with a problem, visit ASCH.net now.
Constant Contact and your small business make a perfect fit for marketing. They give you what you need to succeed. Fast and easy email marketing at your fingertips. Visit the HealthyLife.net advertiser page and click on Constant Contact to start your marketing.
Healing and changing children's lives with hypnosis is very real and very possible. Dr. Ron Ambar's new book, Changing Children's Lives with Hypnosis, provides you meaningful stories and expert explanations to show you not only the process of hypnosis, but its many benefits for overall wellness. Whether a parent, practitioner, or medical doctor, this book opens the way to complete connection, so necessary for healing. Get your copy of Changing Children's Lives with Hypnosis at Amazon.com or visit dranbar.com.
HealthyLife.net, where positive overcomes negative.
Dr. Ron Ambar and his dedicated team of healthcare providers offer unique health services to help patients overcome psychological roadblocks or use the power of their minds to improve their overall health and well-being. At Centerpoint Medicine with services in La Jolla, California and Syracuse, New York, this caring staff are waiting just to help you. Find out more at centerpointmedicine.com. Can't wait? Make your appointment now. Call 858-201-4001. That's 858-201-4001.
Radio your way. HealthyLife.net.
Welcome back to Centerpoint with Dr. Ron Anbar. We've been talking a lot about use of words today, and in our last segment, I'm going to give you 3 tips about how you can use words better beginning today, and it will change your life as long as you allow it to change your life. Like everything else that we talk about on this show, you can help yourself if you intend to do so. So intention is key. So 3 points of how to use words in a way that helps you. The first idea is the idea of positive words. saying things in a positive way. Because just like Henry Ford said, how you think about something has an effect on what occurs. So, for example, let's say you have a test tomorrow and you're anxious about taking a test. It could be a school test, it could be a medical college admission test, it could be a driving test. You're anxious about the test. And you tell yourself, I am quite anxious about this test, so how I'll perform. I might fail. And when you tell yourself those things, you become more anxious because what you say is what happens. When you say you might fail, you think that could actually happen, so you get even more nervous. So what I teach patients, and what I'm teaching right now to you, is think about it in a different way. Think about it in a way you're still thinking about the fact that you're having a test tomorrow. You're still worried about it, but think about it in a way that will be helpful. So instead of saying I'm nervous, tell yourself how you want to be. Tomorrow, when I take my test, I want to be as calm as possible. I want to be confident. I want to do well in my test and get an A or pass it, whatever the test is. Think about what you want rather than what you don't want. And the reason this works is because when you say, I'm nervous about the test, your brain's saying, I am nervous about the test, and you feel nervous. When you say, I want to be calm about the test, the brain's thinking, I want to be calm. How do I get there? And then you're more apt to be calm. Let's take another example. And I'll give you the example. I'll let you have a moment to think about how you'd rephrase it. So let's say you have a stomach ache. We talked about GI issues. You have a stomach ache. How can you think about having a stomach ache in a positive way? So you could say, my stomach bothers me, but that's not positive, right? You could say, my stomach doesn't feel good, but that's not positive either. So the answer often starts with, I wish or I want. I wish or I want. So you might say, I wish my stomach didn't hurt. Well, that's not positive either because you mentioned the word hurt. So what can you say? You could say, I wish my stomach felt better. That's good. Or you could say, I wish I could eat things easily, if that's part of the issue. So again, the whole idea with positive words is to say what you want to happen as opposed to what you don't want to happen. And you could do this when you interact with your kids. If you're a parent, if your children are fighting, don't say, stop fighting. Say, be peaceful, be calm, go to your rooms and relax. Give a positive suggestion rather than what you don't want to occur. So that's what positive talk is. Now, make sure you don't confuse positive talk with affirmations. Affirmations might be something like, I am smart. I am beautiful. I can do this. Those are, there's a whole class of people who talk about use affirmations to help yourself get to where you want to go. The trouble is, if you don't believe you're smart, if you don't believe you're beautiful, if you don't believe you can do it, then a part of you is saying, you're not smart, you're dumb, or you're not beautiful, you've got something wrong with your appearance. So when you say an affirmation, sometimes you have a negating thought right away. Positive talk is saying, if you don't believe you're smart, I want to be smarter. I want to be more beautiful. I want to be able to do this. That you can 100% endorse. In fact, if you can't endorse it, then there's a whole other discussion. If you can't endorse wanting to be smart, then we have to discuss why not. But most people will endorse a positive statement. So, again, when you use positive talk, make sure it's what you want as opposed to just an affirmation. Is I am this when you're not quite there yet. So that's the first idea, positive talk. The next thought is about the word try. Try is not a good word to use. You say, let's do something new. Let's try it. That implies that you may not succeed. Avoid using the word try. If you want to do something, do it well, say, I'm going to do it. I'll either succeed or I'll learn from the experience. Either way, I'm going to come out ahead. Try, actually, as I think we talked about in last week's show, just as a reminder, whenever we say in the past, I tried something, you always imply that you failed. Right? If you did something in the past and you succeeded, you say, I did it. But if you failed, you say, I tried it. So try really has a lot of negative connotations and is a word that should be avoided. As Yoda said, do or do not. There is no try. So that's the second word to work on. Third word to work on is the word if. And when you talk to someone and I was going to say use the word try. I should not do that. When you are talking to someone and want to help them improve, and you say something like, well, if you do this, then something will be good. I remember when I was reducing my weight, my physician said to me, if you continue doing so, I'll be impressed. But if expresses doubt. If it's like try, it's like, maybe you won't do this, or I don't really believe you can do this. And so a much better word is when. When you continue reducing weight, I'll be very impressed. When you accomplish this task, you will succeed. So when you talk to people, you want to help them by showing confidence in their ability to succeed. So don't tell them to try things. Don't tell them, if this works, I'll be impressed. Tell them to do things, and when it works, you'll be impressed. And when you do this, I think you'll find people responding really, really well. And as we talked about in last week's show, and just as a reminder for those who you may not have heard, another word to avoid is but. So, for example, one time my wife was away for a few days, and she came home, and I had 4 kids at home I was taking care of. I did my very best, and the kitchen was pretty neat, and she came into the house and she said, "Oh, the kitchen's pretty neat, but the kitchen table is messy," and that negated the statement she made. So, but is a word to avoid, and instead you might use the word and. So the kitchen is neat, and the table could be even neater. I really appreciate the work you did. So it's a much nicer way of giving feedback. So 3 points: use positive words, avoid the word try, do instead of try, and when instead of if. Thank you so much for joining us. This is Centerpoint with Dr. Ron Anbar.